good to see you all. I want to thank Saili first because she's the one that introduced me to Dr. Balkrishna Jahagirdar about 2 months ago. And once I came to know that he's a oncologist and doing community work, and I thought that it would be a good idea to have him on Sri Yoga platform. And along with him, it's good to know that uh, Dr. Or Vaidya Archana Insekar and also Dr. or Vaidya Dhananjay Insekar are also joining. So you are going to get an integrated approach to how to deal with cancer. So from both Dr. Jahagirdar and as well as from yoga and Ayurveda perspective. So thank you all three of you for doing that. Briefly about Dr. Balkrishna Jahagirdar. He's an oncologist and also hematologist, and he has been practicing in Minneapolis or suburbs of Minneapolis, somewhere there. And he has many years of practice. His passion has been in medicine, and so he's in the right field. Whatever is his passion, he's working in that field. And he has won various awards and is always on the top list of doctors in that area. People, his patients call him Dr. J. And it's interesting that one thing that I read is that you need humor to deal with the tumor. So that's what he has on his page. And again, he's a medical doctor. He has been on board of directors for various medical organizations. He is also on faculty at University of Minnesota. So welcome, Dr. Jahagirdar Balkrishna. And he's bringing two other experts. Vaidya Dhananjay Insekar. I hope I'm pronouncing it correctly. Correct? And yes. So he has BMS in Ayurveda, and also from the S. Vyasa University, has a master's in yoga and also a diploma in physical therapy. He has been teaching in the Yashwantrao Chavan school, open school, university. And so it's good to have that perspective of both yoga and Ayurveda. And his wife, Archana, hello Archana, and she's a top ranker in in her academic life, and she has written various papers, research papers, and also she's working on 3 different books. I don't know the titles, but I'm assuming they are related to your field. And she's head of department. I forgot the name of the university that you are teaching.
Government Ayurved College, Baramati.
I see. Okay.
Department of Sanskrit, that is PSN, related to PSN.
Okay. And overall, she is giving consultation on various areas related to wellness, including lifestyle management, diabetes, cancer, health services, and so on. So welcome to all 3 of you. And again, this is brief introduction. I will include all your bios when we send out the YouTube link. And thank you all. And so again, if I miss something, Dr. Balkrishna, you can go ahead and talk about it.
Okay. All right. Well, first of all, thank you very much for giving us this opportunity to present in front of this group. And I have heard a lot of really good things about this group from Sabnis Kaka, as well as from Saili and others. And I had the opportunity and pleasure of meeting Sabnis Kaka, and I was really impressed by how fit he is physically and mentally. And I won't say how old he is, but he's young at heart still. And that's good. And I think the credit goes to his lifestyle. And that's what we will be talking a lot about today. So, we title our talk as Cancer, Don't Be Afraid of It. Mark the word afraid. What I mean by that is that a lot of people are really scared of cancer. And with that comes anxiety. With that comes the hiding of the cancer and not telling anyone about it, and then delaying the diagnosis. That's what eventually results in late stage diagnosis of the cancer. So what we want to do is actually emphasize the prevention and early detection so we can cure the cancer at an early stage. And my childhood best friend Dhananjay Inchekar and Vaidya Archana Inchekar have joined us for this, and I'm really truly grateful to them because they are about 12 hours ahead of us, and it's morning there, and they have to leave for work, and they were very gracious with their time. So thank you both, Dhananjay and Archana. Okay, does this picture look familiar to you? This is a mother.
But we can't see the picture because I think you need to be in the presentation mode. Right now, go on the next slide. We can't see the slide.
Oh, okay. Give me just 1 second. Can you see this picture now? Just 1 second. Can you see this picture?
Yes, yeah. Indian's parent spouse. Yeah, we can see that.
That's okay. Perfect. Okay.
Yes,
yeah.
we can see.
Okay, perfect. Yeah. What do you see in this picture? This picture is very familiar to all of us, right? This is a mother who has a husband. So these are parents who are feeding their children, and they're going to look after these children. There may be nephews, nieces in there. They are very happy doing that. What do you think is on the priority list? Their own health. Where does that stand in the priority list for them? Probably nowhere, right? Now, this is probably from an old-time picture. Look at this now. This is us, you, me, today. And what are we still doing? Exactly the same thing. Our priority still lies with our family, more or less. That is our priority rather than our own health, right? We need to change that. And the reason is because our health is really important. As they say, for a vine to be supported, you need a tree to support that. So you need to be first strong to do that. And that's what we want to emphasize today, taking care of yourself. Because cancer and heart disease altogether are responsible for close to about 60% of deaths in the United States. And these are worldwide projections as well, for the most part. About a third of the deaths in this country come from cancer, 27.4%, and about 31% come from heart disease. Other causes this year in projections are lower than that. That also includes accidents. So my probability of developing a cancer as a man is 1 in 2. Just mull over that number for a minute. Okay? 50% chance, 50% probability of developing some type of cancer. And that does not include skin cancer, like the basal cell, squamous cell cancers that you can just yank out, freeze, burn, not those types of cancers, the cancers that can turn into serious conditions and eventually fatal. So that risk is 1 in 2. That's topped in men by prostate cancer, 1 in 8 risk, lung cancer, 1 in 16. Colon, rectum, melanoma is not common among us. I have seen only one patient of Indian or South Asian origin, rather, with melanoma, and kidney and renal cell cancer. And the risk of a woman developing cancer in the United States is 1 in 3. That number is also very huge, high risk here. Breast cancer tops that list, followed by lung, colon, uterine cancer, cancer of the uterine body, or cancer of the cervix that I'll talk about in a bit, and a melanoma, skin cancer in this population. But some of these numbers don't apply to us immigrants, because there are no really good studies done in the immigrant population, unlike the Masala study in cardiovascular risk of immigrants, South Asian immigrants. There are no studies similarly done in the US immigrants of South Asian origin. But if you look at the statistics in India, this year alone, these are the projections. Breast cancer is going to be the most prevalent cancer among Indian women. And this often breaks our heart, my heart, Vaidya Inchekar's heart, to see that a lot of times these cancers could have been detected at an early stage, because they are often neglected breast lumps that women, mothers, sisters, they are ignoring their own body. They can feel a lump in the breast, but they're not bringing it to the attention of a physician, of a doctor. They're not getting their mammograms on time. Because they are they're busy taking their children to the school or tutoring them math, because that's who we are. But that needs to change. And so neglected breast lumps still becoming cancer are common, and early detection of this type of cancer is quite possible and at a curable stage with mammograms starting at age 40. I will re-emphasize this throughout the talk. And then mouth and throat cancer, fortunately, a lot of people here do not smoke or use tobacco in any form, but in India, chewing tobacco is quite common, as well as smoking. So those are the two risk factors for that, including betel nut. Cervical cancer, that cervix is the mouth of the uterus, is a major threat to women worldwide, and it's completely preventable. 100% of cervical cancers are caused by an infection called HPV, for which there is a very effective vaccine. And vaccination as well as screening for it, because oftentimes the HPV infection will antedate or predate the diagnosis of cancer by many years. So if HPV is negative in a woman's cervix, and now there's a home kit available for this testing in the United States, that antedates this diagnosis by about 5 years. So if someone's pap smear is negative and their HPV screening is negative in the United States, the probability of them developing a cervical cancer over the next 5 years is very low. Then lung cancer, strongly linked to smoking, air pollution, and in Asian women, particularly, a particular mutation called EGFR mutation that occurs in never smokers. I still remember seeing patients at Tata Memorial at KEM who were young women relatively, who were never exposed to any type of smoke and none of the carcinogens that we knew about, but they still had a very bad cancer that now is completely treatable, because that was caused by a particular type of mutation called an EGFR mutation that I will come to in a bit. And then stomach cancer among all the Asians, East Asians, South Asians, and people from all the developing countries is caused by H. pylori infection. This is an infection you may or may not have heard about because it's not commonly advertised. This is a very, very small comma-like bacterium that infects the gut, that infects the stomach, and that's what results in this type of cancer. It is highly diagnosable with a stool test. It is highly preventable with hygiene. So hand washing, using clean utensils, not sharing utensils with others, clean water and food supply, really important. Highly diagnosable, easily diagnosable, and highly treatable cancer if it's diagnosed early on. If it's diagnosed late, oftentimes patients lose the stomach, or it's diagnosed too late. So important, India should be considering, probably, or South Asian countries should be considering doing screening for this infection because it's highly treatable with antibiotic, a course of antibiotic. Then colorectal cancer, unfortunately, this we never saw in Indian population, or was very low in incidence. It was more or less a Western disease. But now we are seeing it in Indian population, and also at a younger age. So if you notice any black stools, red stools, altered bowel habits, the stools are less frequent, more constipation, caliber of the stool is less or smaller, then that may be a sign of it. Be sure to check with your doctor. Early detection and cure is possible because colonic polyps antedate or predate the diagnosis or occur about 10 years before development of cancer. A polyp turns into a cancer, takes about 10 years to do that. So if you can snatch out that cancer causing polyp before it becomes cancer, you can cure this disease. So that's important. So now colonoscopy is recommended at age 45 without family history, and at a younger age, about 10 years earlier than the first family member diagnosed with cancer of the colon in the family. Liver cancer, often diagnosed late. It's linked to hepatitis infections, hepatitis B, hepatitis C infection. Alcohol use is common, and often very under-recognized fat deposition in the liver. It's called non-alcoholic fatty liver disease. And just in my medical school in KM Hospital, Amitabh Bachchan, who was our ambassador to the WHO, recently has made it his life's mission actually to make people aware of hepatitis and the non-alcoholic fatty liver disease induced hepatitis as one of the causes. And what causes that? It's not a surprise. Fat deposition anywhere else in the body also predisposes you to have fat deposition in the liver. So may not be a cause of all of you fit people, but people with fat, which tends to occur in Asian population, is a risk factor. Esophageal cancer, again, associated with heartburn, tobacco use, alcohol, and poor nutrition. And then prostate cancer is quite common. As we are living longer and longer, this has become one of the diseases that I do see in the South Asian Indian population. And it can easily be screened for and diagnosed early with a PSA blood test, prostate-specific antigen blood test, starting at age 50. So I get it done on myself from age 50 onwards, and I would urge all of you to at least discuss the pros and cons of this test with your doctor. And ovarian cancer, this is a leading cause of gynecologic cancer deaths. Unfortunately, there is not a good screening test for this type of cancer. It often presents with unexplained, vague symptoms of abdominal bloating, distension, and so many diseases, so many conditions can cause it that often the diagnosis is made late. But even then, we can still control the disease for a long period of time if it's only confined to the abdominal cavity. And so please seek your doctor's advice if you see any of this. And cancer is not new. Okay, the word cancer, as you know, comes from crab. The description was somewhere around the turn of the millennium, the last millennium, around 2000 years ago. And before that, it was described about 1600 BC. The first description of it that is recorded is from the Edwin Smith's Papyrus from 1600 BC, and it now rests in the New York Academy of Medicine. And similar descriptions of cancer also come from Charak Samhita in our own Ayurvedic medicine. And in the Charak Samhita, in the 87th verse, there is a description of it where the author writes that as Granthi and Arbuda, that's what a tumor is called, are similar in site, etiology, meaning the cause, character, dosha, and dosha. Physicians should treat Arbuda on the lines of treatment of Granthi, meaning if you can remove it, remove it. This was back 2000 plus years ago now. And so cancer has been around with us for a long time. In this Samhita, there's also description of metastasis. There's also a description of recurrence of the cancer, and there are definite terms described for it. So it's been around for a long time. And who is better qualified to describe this from the Ayurvedic standpoint than my good friend, Archana Inchikar? So I would like to invite her to enlighten us about the Ayurvedic viewpoint of cancer, as well as the current role of Ayurvedic medicine. What does she see it? Where does it see she see it fit in today's world? So please welcome Vaidya Archana Inchikar.
Thank you, Dr. Jahagirdar sir, and thank you organizers for being such a great opportunity for us to share our few experienced views, and it's really a knowledge which is very helpful in current era, modern era, because this ancient foundation of life is indeed it's useful in every time, each time. And now I think what we need is this way of life. Okay, is it screens visible?
हो.
आहे.
Okay, slide show. Right. So, as the given topic, or I'm an practitioner of this Indian traditional system, Ayurveda, I have been completed my post graduation in Trivandrum, and that time before 30 years, I was with the team of cancer research based on Government of India, along with this integrated approach. So from that time also, I will. I always realize that it should be in integration because there are a few strengths of Ayurveda which I'm here wish to share. So what it is a strength of first strength is a prevention, and not only cancer but many of the things can be prevented. What we are facing today, and in a very excellent and very perfect way, Dr. Jahagirdar have mentioned that early detection is very necessary. What we ignore, what the overall population's pattern of thinking that the health comes at last. It is not still priority. And Ayurveda starts with that. First sloka of Ayurveda, it is mentioned to view our own health as well as early as we get in the morning. In funny ways, in student life, we were not able to accept it. It is why it is so given in this way that we have to look in mirror as early as possible when we get early in morning. So, but now we understood what was their ancient scientists' guideline behind that. We have to look each and every fine status of our health, physical appearance, our mental health, our emotional or our stress levels. We need to monitor it. Who who else can do the best for us? That first person, we can say that we are our own Vaidya in first level. We are our own doctor because we are going to identify at first level what is going to disturb, what is okay. So it is our priority. It is a first that is a first step of prevention, to look after every system, every function, every thing of the health, every component of the health. That is a prevention. And what are the management? It is also I'm trying to cover in a brief manner here. So let's start with this prayer because Dhanvantari is a god of our ancient Indian medical system. Ayurveda comes with the Amrita, that is a vital solution that recovers everything, every disease, every health issue in all dimensions, what we want to see. So these are the Ayurveda's view regarding the health and ill health. What in this awareness process or this awareness campaign, we need to understand the health also. When we are supposed to maintain it, we are trying to avoid each and every disease which affects these levels: the physical level of health, the psychological level, also social level is as much as important of tools, emotional and this is cognitive functions as well as emotional functions, because stress levels starts from there. And more and more regarding the now modern NCDs, non-communicable diseases, including cancer, stress is one of the significant factor. Spiritual level here, it is not only regarding this adhyatmic level, but it is according to the foundation of fundamental concepts of Ayurveda. Spiritual base, that is we can say Anandamaya Kosh in yoga, or our the best level of existence. It is our best defense mechanism. Once we are uh, with the good practice of maintaining the spiritual health, we will be more and more healthy in all dimensions. This is a always basic concepts of Ayurveda, because these are only the ways to preserve the health and to prevent the diseases. And to in management also it plays an important role, because at every level defense mechanism of the body against any disease, against cancer also, it is depend on these the fitness of these levels. We need to give strength at the physical level as well as mental health. Our social health also is a good defense mechanism for us in healing system. And the most important, which is still not scientifically explained well in this phase also, what is the role of spiritual. It is not, as I told, it is not related to any religion or any simply Adhyatmic practice. It is a best defense mechanism. We can say shortly that the challenging of every advanced disease or every advanced stage of cancer, where we can have this, we can say that this is a bad prognosis. There also, if our Anandamoy Kosh or our this spiritual strength is well, we can have a good speed of recovery and good quality of life too. It is we have seen and we have just had very few data related to that also. Here it's very my favorite quotation with my specialized subject. This says prevention and promotion of health. This is the main objective of Ayurveda. Prayojanam chasyam swasthasya swasthya rakshanam. So this whole Indian medical science, Ayurveda, it is it's great. It's only origin from Veda, that is 4,000 before centuries time, and having all the essence of this health system. But it is in very summarizing Sutra Rupa. So we need to just evaluate it in with the current references. Objective is given this a prevention of health. So prevention of health from many of the upcoming emerging diseases too. So as Dr. Jahagirdar has mentioned the quotation of Granthi and Arbuda related to cancer, it is same for many of the diseases that we have little bit in short, in brief references of modern diseases also. So there are the concepts mentioned, the etiological factors, how to prevent them, how to strengthen our defense mechanism related to each and every upcoming imbalanced or risk factors we can say nowadays, and a very, very scientific description regarding the prevention, which includes a proper lifestyle, proper dietary guidelines in very detail. We can say half of my subject is only a dietetics, and rather another one is a lifestyle guidelines in very scientific and very, you can say, prescribed manner. So early morning time of awakening is a Brahma Murta. That also is a very great and very helpful for detoxification, like our sleep patterns, and each and every factors. It is not I'm not able to include all the things today itself, but that is a very uh, proper and very descriptive, very scientifically explained material regarding this lifestyle and these preventive measures in Ayurveda. So it is really helpful in cancer, managing the cancer, because even if any stage it is diagnosed, if the lifestyle we maintain, we will be better speed of recovery. We will be able to defend it in good way. It is our experience. Second is a Aturasi Vikar Prashamanam. So it is not only traditional or it is not only like Jadi Buti type of medicine. It is a proper Indian medical system which includes classification of diseases, pathophysiology of diseases, and management steps, primary, secondary, tertiary, likewise, surgeries, and all the details regarding the management of diseases. This is what I have just introduced about Ayurveda here. So the concepts of health and ill health, equilibrium of dosha dhatu mala, equilibrium of mind, that is a well or enhance sattva and control raja and tama. Then all the balanced sensory functions. It is a just explained definition of health in Ayurveda. Samadoshaha, Samagnishcha, Samadhatu, Malakriyaha. So why I'm just mentioning it here? Because it is our ultimate goal. Even for the prevention of cancer also, we are trying to avoid all the attacks, all the disturbances in health, and we need to maintain it every day. It is our main direction of work, even personal health, because I always share with my patients that treatment is not only doctor, it is a teamwork of patient and doctor. We are only the persons which mention the things what to do, but the active person here, active participant is a society members or the patients. So main role is yours. And it is important that this knowledge should not be limited in the only group of doctors. It is for society. So what we should able to just understand what is equilibrium of dosha, that every function, that is digestive, respiratory, our sleep factors, the lightness of body, and all this sign and symptom, then without any external stimulation we can be happy. That is a healthy state of mind, the calmness of mind. We don't need any external stimulation to be happy always. Likewise, we need to monitor, we need to observe our health day by day, every day. And if we notice any disturbance, we need to contact expert. It is a way of prevention. We can detect it in early phase. What is to be disturbed? If any symptom persists continuously, we must contact. It is what we know. No, the etiology of it is still unknown and still unclear. So nowadays, what we can do, we can observe ourselves, observe our fitness. We can be confident that okay, we have this fitness. We have continuous monitoring should be there from our side. So this equilibrium is a key of all the prevention. And what define disease is a pain, any type of disease, a misery, a pain. According to Ayurveda, we need to treat it. We need to do any type of action. In Ayurveda, there are many type of great and very scientific actions, treatment parts or management parts are given. We'll see in very short. So it is a one quotation which Vikaro Dhatu Vaishamyam. Dhatu means all this body constitutes. Rasa, Rakta, Mausa, Meda and all. What we consists our physical body. To any type of unequilibrium or that is vikar, and prakriti is a good maintenance. It is called as samya. Same it is mentioned in yoga. What Dr. Dhananjay will explain. Okay. So from here, I want to share a few. I don't know why. Okay. So sorry, I think my another set of PPT will be there. I will explain just in verbal way here. So I will start one of my case, chronic myeloid leukemia. You can say it's blood cancer. The person of 80 years old came because one of his family member was my patient, and he came with a reference. He was not able to go for chemotherapy, so he came to alternative medicine. And I have taken history. He was a real leader of this village, and he used to travel in walking many kilometers and only having a little food. So what we say that nowadays that low calorie and low diet is always good, but Ayurveda says no, it's not. According to your own expenditure of calorie. If the person is walking kilometers to kilometers in this village and not having a little bit enough food, it is also a stress factor for body physiology. So, Sarva Dharmeshu Madhyamaha. It is a Sanskrit quotation. We need to go in very humble way, not to any extreme type of these guidelines, that even not only raw food is good, not only non-veg food is good. We need to go for a moderate pattern and according to own prakriti. What we prakriti shabd here also, one having a pata predominance need to have some anshas, that is a very ghee and oily and very soothing diet. Ones who is having kapha prakriti, having a higher anabolic rate, need to go for moderate or little less caloric food. The pitta who is having very heat in this body constitution, that is the individualized health aspect of Ayurveda. It is one of the strength of Ayurveda, that there should not be same roof for all the population. We need to understand what is our body constitute. It is vata predominant, pitta or kapha, and then we have to go for our diet plan or our lifestyle also. Nowadays, many of incidents we have observed in India, that heavy gym work can affect our heart. So exercise is also should be in according to own strength, the physical capacity. Likewise, our mind also, we need to care about that. How much stress we are going to tolerate. We need to monitor it. It's whatsoever. And the most important regarding the cancer is the Agni concept.
So
The
actually,
digestive fire, we can say. Digestive fire is a, yeah.
Just in case you're not using those slides, we can stop the screen share and then we
Okay.
can.
Yeah, sure, sure.
Yeah,
Is it
and
okay
then
now?
maybe spotlight you so that. Yeah. Okay. Good. Thank you.
So, the experience for 30 years, what I understood, because as we all know that still cancer it is not any established or the fixed solution in treatment what part we have, but in the research shows that in etiological factors there are many assumptions, and every day we are coming with a new perspective, new knowledge. But in from Kerala, traditional Vaidyas, from Gujarat, whatever I have just interacted with in Indian senior Vaidyas, all practitioners in their practice with the patients data, they have come with few conclusive point that the lifestyle plays a prime important role to disturb the DNA programming. So what we take casually, what the same thing Dr. Jahagirdar mentioned in a very perfect pictorial, that the family two pictures, that we still are not with the priority of our own health. Lifestyle, many times the food timings are that also that much important. The quality of food, the method of preparation, the freshness of food, and the free toxic, that the pesticides and all things we need to consider. Uh, so it is a great challenge to be safe in these modern days. But Ayurveda helps there also. The detoxification, Panchakarma is another very effective preventive tool. What happens that with seasonal cycle, Ayurveda mentioned 6 rutus in our ancient time. This Varsha, Sharad, Hemanta, Shishir, Vasanta, Grishma, and there are many changes as environmental changes we observe in nature. Our body gets also same effects, and there are various different stages of Vata, Pitta, Kapha in the body. This balance gets disturbed physiologically. If we will not consider the changes, and time to time detoxification mentioned in Ayurveda, that in rainy season we should go for basti. In Vasant, that holy season in India, it may not be same to same in what we your native place, but there are some effects of environment, and we need to, yeah, sure. Specific Ayurveda guidelines for cancer patient. I'm coming to that home kitchen or traditional herbs is a very magical, we can say, having this, what we can do from our kitchen side or our own. It's a herbal preparations or herbs like haldi. Nowadays, everyone is aware that haridra or curcuma longa is a great potential to prevent growth of cancer. Another gomutra or cow urine is also very effective. Uh, it is observed in many cases, anti-cancerous property of gomutra. Then spices, that is shunthi, ginger, dry ginger, pimpli, or black pepper. These are very effective on this agony. What we can, which can prevent the extra growth of cells, which can maintain our tissues, and which can slow down all this growth. The granthi and arbud is nothing but a excessive growth of cells, unlimited growth of cells. So these herbs are very effective. Ayurveda also given this classification of Indian medicines based on the different organs. Likewise, even drinking water with a silver glass. Silver is a metal which is very protective for brain cells. It is proven. One of the Indian Vaidya, Balendu Prakash, it is in many cases still studies going on. Likewise, gold also. We wear gold in India. Sona, it's a very सोनं हे अतिशय आपल्यासाठी valuable असतं. But in medicine also, the medical property or the medicinal value of is also great. Now there are many Indian pharmaceuticals which are having proven free metal tests, and this gold preparation, Suvarna Bhasma and all. These are also best in immunomodulate many cancer patients. In my what I was telling case, that person taken 6 to 7 years treatment and he was fine with only Ayurveda treatment. He lived till the age of 88, and reports was very improved. Nowadays, I'm not prepared with this because I had been in another work in my college. So but there are many cases which encourages us to work in an integrated way for these patients. Okay, yeah, sure. So Ayurveda is a very huge science, and I have just tried to just summarize a few aspects or few views related to these things, and I'm really thankful and very pleased, very happy to be with you for this session. And thank you, Balkrishna sir. Thank you, Sabnis sir. And thank you, Saili. Yes, thank you very much.
Yeah, I know you have to leave shortly, so thank you so much for that excellent overview of Ayurveda in a very, very short period of time. But Sabnis Kaka, you can consider bringing this powerful couple back again for another talk at some other time. But Dr. Dhananjay Inchekar will be with us. I will do the rest of the presentation, and then Dr. Dhananjay or Vaidya Dhananjay will do his presentation on yoga at the end of it. So thank you so much, Vaidya Archana. And I'm going to start sharing the screen here in a second.
Thank you, Archana.
Do that again. Okay. And okay. You can see the screen, right? Okay.
Yes.
So yeah, like Vaidya Archana said, Ayurvedic medicine has been describing this for a long period of time. So have the Chinese medicine folks have been describing it, cancer, for a long time. And so were the other ancient pathies describing it earlier. But it was not until 1879 when Carl Zeiss first invented the microscope, that it gave us the ability to look at the cells in the body and to even recognize that there are cells in the body that actually are responsible for this cancer. And it was later on in 1821 to 1902, this founder of cellular pathology was Rudolf Virchow. Until then, we were believing that cancer was caused by bad bile, for example, so we would call it, or by jadoo tona, right? That was the initial thought. We did not know what cancer was exactly. So what is cancer? How do we understand it now? So cancer is essentially uncontrolled growth of cells that do not function normally. So take example of, for example, a lung or a leukemia cell. A leukemia cell is supposed to, the white blood cell is supposed to fight infection, but it's not fighting the infection. It's not doing that job normally that it's supposed to perform that function. And it spreads in places where it's not supposed to, and it does not stop growing. So it's basically excess cell production because of uncontrolled cell growth or proliferation of the cell. These cells start dividing on their own, and I will explain that to you in a bit. And then they have the ability to divide indefinitely for a long period of time. And then that they do not undergo cell death, normal cell death. They do not stop when they're supposed to stop dividing. So let me see if this will come through. Can you see this? No.
Go on the next slide, then we'll see it. Yeah, now we can see.
We can't see it actually. Yeah, okay, that's okay. So what this is basically, I just go here. Okay, so all of us, as you know, are born out of two cells. So a mother's ovum or egg and a father's sperm. And so when they meet, that results in initial one cell formation. Those cells keep dividing. They undergo countless divisions with absolute fidelity, meaning thereby these cells that are produced from them are exact carbon copies of the other cells. And then eventually they start differentiating into different body parts. So isn't it amazing that this cell, this single cell that is here, is able to form all the organs in the body? It's like you sow a seed in the soil, and that seed gives rise to the entire plant. That plant has leaves, it knows exactly when to blossom, when to flower, like the tulips are coming out now, or at least we wish they are coming out now. So that is really amazing. Nature is completely amazing. It knows exactly when to activate certain programs to do certain jobs and when to stop doing them. So if Atman, our younger one back then, if he wanted to be like a Superman, he wouldn't be able to grow these muscles, because his muscle cells will stop growing at a certain time. Sorry, if this presentation word, that would have been nice, but this is okay. So in other words, the cells in our body, if you think about an individual cell in the body, it is like a car that's going in the cruise control mode. This is from a street of San Francisco. As you know, they're up and down. So if you set the speed for, let's say, for example, 60 miles, then the brakes are applied when you exceed that speed downhill. When you're going uphill, accelerator is pushed to maintain that speed. So the body always makes the number of cells that are needed to do the job, not more, not less. And that cruise control computer in the car is a computer that is man-made. Here, that comes in the genes. So there are trillions and trillions of cells in the body that are going on these streets of the body every single day, undergoing these cell divisions. Have any of you sat in an autonomous car yet? Right? I am very afraid of sitting in an autonomous car. And just imagine the whole city has just autonomous cars. If there's damage to one car's cruise control, imagine what will happen, right? There will be pileups of cars everywhere. And that's what happens in case of cancer. Either it is failure of the brakes, or the accelerator is stuck to the ground, to the floor. It's pushed all the way to the floor. So the car is accelerating or it can't stop. Okay. So there are genes in the body that apply brakes for cell division. Say, enough is enough. We needed 2,000 cells. You've produced 2,002 cells. Enough. Let's stop the production. So these are the brakes. If those are damaged, the cells will continue to grow without any brakes. Or the genes that are actually causing proliferation or division of the cell. And if the accelerator is pushed to the floor here, the car will keep going without stopping, right? And all of us are familiar with this problem that the Ford Motor Company had previously with the cruise control mechanism, right? So there were lots of recalls caused by that. So that defective mechanism can either come from the cruise control failure, can come from the company, from the manufacturing plant itself, or it may be acquired during the lifetime of the vehicle, right? So you can inherit this right from birth, okay? And those are the genes that cause cancer in families. Those cancers typically tend to occur early on. So if you see someone with a breast cancer at age 20, 30, 40, right? Think about genetic inherited syndromes. Ovarian cancer, number of other cancers you see occur at a younger age in familial cancer syndromes. And those genes that are responsible for it, the most common ones are listed here. The BRCA genes that you know about, these are seen in people of Jewish ancestry most commonly, but I have seen a lot of Indian, South Asian people with one of these two genes. I have a family actually with a patient of mine has both of these genes, BRCA1 and 2 genes. They are at risk for developing breast, ovarian, prostate, pancreatic cancer. And the lifetime risk is 72% for breast cancer with BRCA1 carriers. Then there is TP53 mutation, MLH. These genes, these names don't mean anything to you. But if you see someone or a family that has clustering of cancers, multiple cancers in the family, especially occurring at a younger age, inbreeding in the family, inbreeding in the community, think about inherited cancer syndromes. And there are genetic counselors who can look for these. Then infections can cause cancer. What's happening there is that the cruise control mechanism was fine when you bought the car, but over the lifetime of the car, when you drove it to 100,000 miles, some environmental factors damaged it. And then the cruise control is now not working. And so that those are acquired factors, not inherited necessarily. So HPV infection is responsible for universally for cervical cancer, anal cancer, penile cancer, and a proportion of throat cancers. Hepatitis B and C infections for liver cancer, Helicobacter pylori infection that we talked about earlier for stomach cancer. These other ones, EBV, are rare, and we usually see them in a minority of patients with cancer. Then tobacco, all of you know about lung cancer being caused by tobacco. We talked about mouth and throat cancers being caused by tobacco exposure, either by chewing or by smoking. Esophageal cancer is another example. These chemicals, they get out of the body through the urine. So the whole urinary tract is exposed to it. You don't commonly think about kidney cancer or urinary bladder cancer being caused by tobacco smoke exposure, but those are some of the most common causes. Tobacco smoke exposure is one of the common causes of urinary bladder cancer and kidney cancer because those tobacco toxic chemicals are getting out of the body through the urine. Also pancreatic cancer and cervical cancer, as well as acute myeloid leukemia are associated with tobacco smoking. So most of you don't smoke, I know, but if you know someone smoking, discourage them from doing that. Same story with alcohol, mouth, throat, voice box cancer, esophageal cancer, and liver cancer. We just talked about fat deposition in different parts of the body. Fat produces estrogen. So in women who are obese, the risk of breast cancer is increased, especially after menopause. Endometrial cancer, the cancer of the inner lining of the uterus, is also higher in incidence in obese individuals. Esophageal cancer, because it causes heart reflux of acid from the stomach into the esophagus. That irritates the lining of the esophagus and causes esophageal cancer. So uncontrolled acid reflux causes that. Liver cancer, we just talked about fat deposition in the liver causing cirrhosis of the liver and cancer of the liver. Now that's more common than hepatitis B and hepatitis C or alcoholic hepatitis actually. Non-alcoholic fatty liver disease is more common now. Gallbladder cancer more common in obese individuals, as well as colorectal cancer too. Then there are other environmental factors that are responsible for it. So air pollution, it's very imaginable. Lung cancer, bladder cancer for the reasons that we just discussed. Asbestos causing mesothelioma, benzene causing leukemia. Fortunately, we are not exposed to these most of the times nowadays. UV radiation, and then thyroid cancer and leukemia caused by ionizing radiation. So if there is a radiation mishap somewhere, like the Chernobyl, there was increased incidence of thyroid cancer and leukemia in those people. Something that's really underemphasized and understudied, but is coming to the light now, is microplastic. How many of us drink or have had water that is stored in plastic bottles for a long, long time, right? And imagine those bottles being literally boiled, the water literally boiled in the 44-degree heat of Nagpur, right? And what all chemicals are released in that, right? So there are a lot of chemicals that are released by microparticles, and I'm not even talking about nanoparticles. Those are even tinier particles. Those particles are now found in many, many different organisms, meaning fishes, other things. And most recently, there was a study you might have seen in lay press that it was associated with deposition, these microparticles, in the blood vessels, causing heart disease and stroke and other things. So beware of that. Certainly do not microwave plastic. And then there are PFAS, the chemicals, forever chemicals, perfluorophorams that are responsible for a lot of cancers and other things. And the big companies are going to suppress that, right? Watch Erin Brockovich, what troubles people have to go through to bring these things to the light of lay people. So beware of those. Our old lifestyle was really good. Using stainless steel is really good. Utensils, do not use plastic utensils. We practice that in our home. Then diet and nutritional factors, and Vaidya Inchekar, Archana just explained that very elegantly to you, that balanced diet is really, really important. Red meat, fortunately, a lot of us do not eat, so that is not good for you. But colorectal cancer incidence is increased because of that. And then fruits and vegetables are really important. Fiber dilutes some of those chemicals, and that's thought to be one of the reasons. Curcumin, she just spoke about. Black pepper, she just spoke about. All of those are important. And having a balance, do not do excess of anything. She really elegantly explained that equilibrium is really important, having a balance of everything. Do not go to the extremes. Those are not good. And consume at least 5 servings of fruits and vegetables. Estrogen exposure that's unnatural also increases the risk of breast cancer and cancer of the inner lining of the uterus, the endometrial cancer. So early menstruation, late menopause, hormone replacement therapy is questionable, but anything that's unnatural. Today, yesterday there was data saying that there's increased risk of cancer. Today there's going to be another paper saying there's no increased risk of cancer. But who knows exactly, right? The nature stops making estrogen for a reason. So if it is doing that, there's a reason for that. That's how I think about it. So try to avoid those as well. Fortunately, the mortality from cancer, with our understanding of the causes of cancer and the modern treatments, is declining. So as you can see here, from 1990s to 2020, there was already a significant decline in the mortality or death from cancer. And these are the lives that were saved until 2020. These were the projections in the red line, and these are the current trends back then in 2010. Now, remember, since then, there were lots of developments in cancer. And our ability to distinguish and exploit the weaknesses of cancer cell compared to its neighboring surrounding normal cells. Remember, a breast cancer has most of the surrounding tissue is normal breast. How do we exactly target the breast cancer cell that's in the liver, for example, right? So our ability to do that in understanding how it's different, how Osama bin Laden is living in this house, and how can we precisely target that and leave the rest of the population of Abbottabad untouched, that's where the precision medicine comes in. And our ability to do that has allowed us to minimize the side effects of the treatment and more effectively treat the cancer. And all of that started in 2001. Before this, patients with chronic myelogenous leukemia, the disease that Vaidya Inchekar just described, for which this poor person could not afford the treatment, actually, is what I'm guessing was the reason he did not get the treatment, was walking miles together, could not afford good food. That's very sad. But that disease, people we used to die from that previously, but then came a pill knowing that there is a particular mutation that results in this cancer, and we are able to switch off that mutation. That's resulting in cure of this disease. Patients with that disease in my own hands are living normal life, just like cancer being treated as high blood pressure or diabetes, keeping it under good control just with a pill. piloting planes, doing all sorts of activities, playing sports. That discovery allowed us to recognize a lot more mutations in a lot more cancers. And this is one such example. In non-small cell lung cancer, which used to be a fatal disease, this is a patient that was described in 2006. And because of privacy reasons, I could not show my own patients, but there are lots of patients like this actually. This person turns out to have all of these black dots that you see here are cancer. The cancer started here. This is normal brain, or was normal at that time on this scan. And the cancer had already spread to these areas. Started, and at that time, at the time of diagnosis, had these spots on the brain. This is brain MRI scan. Starts on a tablet, and within 1 month, look at the PET CT scan on this person. All of these spots are gone. And these responses can last for many, many months to a few years. And that's being developed even further now. And the responses are lasting longer and longer with modern therapies. Gone are the days when we used to just do chemotherapy for cancer. Now we are able to precisely deliver the chemical to the abnormal cell, to the cancer cell, sparing the surrounding cells. And this is one such example, an antibody that binds, that has chemotherapy attached to it. It recognizes a particular type of protein called CD30 on the cell and delivers it specifically to that cell, stopping the cell division in its track. We are able to now take out a person's immune cells, the T cells. This is called CAR T cell treatment, where we take out the person's T cells, modify the genome of the T cell, expand it in a petri dish, put it back in the body. So now the person's own immune cells are able to fight the cancer. This has resulted in really long-term survivals in patients with multiple myeloma. And just this week, I mean, just today, actually, there's an abstract discussed at the American Society of Clinical Oncology meeting where a solid tumor is being treated with this therapy, a CAR T cell treatment, with tremendous success. So we are heading in that direction where we are able to use not chemotherapy, but the patient's own immune cells that are quietly watching the cancer grow in the body, modify them, teach them how to recognize cancer, put them back in the body, so the cancer gets killed in the body. We have similarly antibodies that are taking, on one hand, taking the immune cell, attaching to it, bringing it together with the cancer cell. This is one such example, glofitamab, where this antibody recognizes these two cells, the normal T cell and the cancer cell, brings it together, resulting in 70% response rate in B-cell lymphomas. And those are lasting long, and the side effects are minimum. We used to give radiation since the turn of the century, since early 1900s. Madame Curie, Marie Curie, Madame Curie died, won 2 Nobel Prizes, one of the only 3 people who have done that, for her discovery of radiation, the power of radiation. And she unfortunately died of radiation exposure because radiation causes a lot of side effects. Now we are able to use antibodies that are binding to a specific epitope or specific protein on the cancer cell and deliver radiation to this. This is an example of that. It's called lutetium-177 PSMA for prostate cancer, where this radioactive material is attached to this particular thing that recognizes the prostate cancer cell. It gets into the cell and kills the cell by damaging its DNA. Again, resulting in good quality of life and longer survivals. As I was mentioning earlier, as we speak today, there is an ongoing meeting, the world's largest meeting of the oncologists. It's called the American Society of Clinical Oncology meeting. Only the McCormack Place can accommodate 45,000 attendees. That meeting is going on right now. About half of the people are attending it virtually, but there are 7,265 abstracts being presented. These are all new research from all over the world, only in cancer. And some of them are just tremendous, very, very exciting ideas. And so, nevertheless, it all boils down to the basics. Take care of your health, right? And so let's review that. Don't be afraid of cancer. So the American Cancer Society guidelines is what I follow, not the US task force. The cancer screening guidelines for men state that prostate cancer screening should start at age 50, 45 in African American men, and those with family history of cancer by measuring PSA once a year and digital rectal exam. And then talk about that with your primary care provider. Breast cancer screening should start at age 40 to 45. And I would encourage to start it at 40 because as an oncologist, I only see more advanced cases of cancer. So I always then wonder what would have happened if this case was diagnosed earlier. Same. So age 40 to 45, start doing mammograms. Now, the 3D mammograms are better. High breast density might require additional screening, MRI, ultrasound, or your doctors will guide you in that. And those are very specific questions. We can't go in the depth of that. Cervical cancer screening should start at age 25, and primary is HPV testing every 5 years. There are other methods of doing that. And then colorectal cancer screening should start at age 45. Do not be afraid of the prep. A lot of us have had the prep. It's not difficult. You have to do that once every 5 to 10 years. Okay. And do not be afraid of what will be found on that test. Because if it is found today, it's still better. A stitch in time is worth 9, right? So it's really definitely worth doing these tests early on. And we discussed this colorectal lung cancer screening. Majority of people here, I hope, do not smoke. But if you are smoking, first consider quitting smoking, using any form of tobacco. It's not good for you. It's only good for Philip Morris. Who should be having this test? Age 50 to 80, more than 20 pack year smoking history. If someone smokes 1 pack of cigarette per day for more than 20 years, that person should be having that. But that person, if they have not quit within 15 years, last 15 years. And the test is very easy. It's a low dose CT scan of the chest. Now, the sad case that Vaidya Inchekar just described, similar cases are occurring in India, and India is increasing its union budget towards cancer. So a lot of initiatives have taken place under this administration. So again, our take-home message, and Vaidya Inchekar is going to talk after this, is eat healthy, exercise regularly. I'm preaching to the choir here. Avoid tobacco, alcohol, microwaving, plastic, infections that we talked about, asbestos, vaccinate for HPV. This may be your granddaughter, this may be your grandson. Be sure to advise them about this. Cancer screening for breast, cervical, colon, and prostate cancer, and diagnose the cancer early. See your doctor. If you develop any unexplained lump, unintentional weight loss, black stools, red stools, bleeding after menopause or in between menses, difficulty swallowing, abdominal pain, and the list goes on. I don't want to scare you, but at the same time, just know that the earlier you get the investigations done, better it is. And with that, I would like to hand over to Vaidya Dhananjay Inchekar, who is really an expert in yoga for cancer, as well as Ayurvedic medicine.
Thank you, Dr. Balkrishna, my friend. Uh, Thank you, Dr. Sabnis Kaka. It's nice initiative by Sri Yoga, uh, creating awareness regarding cancer. I think Dr. Balkrishna has emphasized the early detection, then early screening, not to afraid of about screening, and then now the many advanced treatments in cancer are available. That targeted therapies, only the cancer cells can be burned out, and other the good cells are not taken any harm. So along with this, now many patients are using complementary and alternative therapies. Like Archana Inchekar told that Ayurveda can be incorporated in treatment of cancer or prevention of the cancer. So, like that is yoga. In 1985, there was a headline in a paper that Dr. Atami from Japan, he returned 20 terminal cancer patients from Alps expedition. That he gave a tremendous confidence to these patients that they can fight with cancer and the illness with that meaningful life therapy, that is yoga, meditation. It is used in that cancer. Now, in many cancer hospitals, like MD Anderson Cancer Hospital in Houston, there is a separate department, integrative department, medicine department. They use yoga as a prevention and curation treatment plan for cancer. So now the role of mind in cancer is can be explained. So stress, as we know, the stress is the part and participle of our life. Everybody has to face the stress situations and pass on the. But what happens due to stress in our body physiology and then mind and then other things we can see now. Next slide, please. Can I?
By next slide, yeah.
Yes.
By sharing has stopped.
Okay, I am restarting the sharing, I thought. Okay, can you see it now?
Yes, yeah.
Yes. No,
Yeah.
you can omit this slide next time.
Okay.
Uh, Psychological effects due to cancer. What happens when a patient detects cancer? The first thing is that fear and worry. Worrisome thoughts comes into mind. Stress and anxiety has increased. Sadness or depression raises. Then trauma of a cancer comes into mind. So these are the key points when the cancer patient comes to know that he is facing a cancer situation. Next. The role of chronic stress. It is well established that chronic stress can promote tumorigenesis and oncogenesis through production of stress hormones. Cortisol is produced in body, and it creates the promotes the tumorigenesis. The activation of inflammation, inflammatory changes takes place at the cellular level, and the suppression of immunity. The immunity is suppressed, so the cancer cells are cancer cells grow in our body. So stress can create ground for cancer growth, and cancer is responsible for physical, psychological, and social level stress. I think this is we should note. Then where what is the role of yoga? First, we have to understand then what is yoga. So I will share my side this screen. I think the Pi translator is not there, so the Sanskrit words cannot visible here. I will share it. So is it visible?
Yes.
Yes.
Hello,
Yes.
can you see the slide?
Yes,
Ah,
it is.
what is yoga? Yoga is, as per Patanjali, great masters of yoga, yoga chitta vritti nirodha means to control mind and its modification is yoga. So and the another definition of yoga is that is mana prashaman upayaha yoga iti abhidhyate. To calm down our mind is called as yoga. And in Bhagavad Gita, it is aptly described that samatvam yoga uchyate. Equanimity is yoga, means to be stable in success or failure. The whole sutra goes like this: yogastha kuru karmani. We should act every time, every moment with tune to infinity, that our own nature. Yogastha kuru karmani sangam tyaktva dhananjaya. Sangam means attachment. We should go beyond the attachment. Sangam tyaktva dhananjaya. Siddhya asiddhyo. Siddhya means success. Asiddhyo means failure. We should go beyond this. सिद्ध असिद्धो समो भूत्वा, take it equally, and samatvam yoga uchyate, equanimity is yoga. So these are the key definitions of yoga. So mind, where the mind role comes here, we can see now. We are as Patanjali described, given us eight limbed yoga, that is asana, pranayam, pratyahara, dharana, dhyan, samadhi, and before that yama and niyamas. It start with yamas. Yamas are the five, that is ahimsa, satya, asteya, brahmacharya, means non-violence, truthfulness. These are the certain do's and don'ts. Shaucha, santosha, ishwar pranidhan. These all help in treating or preventing the our cancer patients. So as yoga understands that our existence is at five levels, that is Annamaya Kosha, Pranamaya Kosha, Manomaya Kosha, Vigyanamaya Kosha, and Anandamaya Kosha. At Anandamaya Kosha level, we are totally disease free. When the picture start at Manomaya Kosha level, Vikshepa means the agitations and depressive thoughts, Laya and Vikshepa, they starts, and the imbalance at a pranic level starts. So the it percolates to our Annamaya Kosha level, that is gross physical body, and the disease gets into existence. This is the concept of yoga, that yoga therapy is based on this concept, that Manomaya Kosha level, the stress which creates at Manomaya Kosha level, it disturbs prana flow, and then the disease is occurred. In yoga, it is said that why we should practice yoga: samadhi bhavanartha, klesha tanukarnarthascha. Klesha means pancha klesha. There are five stress factors. Klesha, they are described. Avidya means ignorance of true nature. Raga means attachment, too much attachment. Dvesha, to strong likes and strong dislikes. You can see in day-to-day life also we face strong likes and strong dislikes, which creates imbalance in our pranic body, and that creates the stress. Avidya, asmita means ahankara, that is ego, that creates whole scenario, that destructive mind. With ahankara, man goes to uh, laya stage. Ahankara, avidya, asmita, raga, dvesha, and abhinivesha. Abhinivesha means the strong mad rush at mind level creates the destruction. So these are the panchakleshas that disturbs our mind, and that when mind is disturbed, the prana flow in our body is disturbed, pranamaya kosha flow is disturbed. So that's why we use nadi shuddhi pranayam, or anulom vilom pranayam. Pranayama is for purification at pranamaya kosha level. In treatment of cancer, what we use in day-to-day patients, that at Annamaya Kosha level, that physical body or gross physical body that we can see, asanas, simple gentle hatha yoga, hatha asanas there we use here. Sukshma Vyayama means the simple Vyayama, where to form the fist and release the fist. With inhalation, form the fist, and with exhalation, release the fist. Diet, sattvic diet is promoted in the patients, and the relaxation techniques, that shavasana, shavasana is called in yoga therapy, that is shrame jate shavasanam chitta vishranti karakam. Means one can rest in shavasana, like a corpus pose, and get rest to his body and mind complex. In pranamaya kosha, what we in pranic body, we gave pranayama, that is anulom vilom pranayam, simple anulom vilom pranayam without kumbhaka. We do not use kumbhaka here because forceful retention causes some hazards also. In Hatayuk Pradipika, it is written that pranayamena yuktena sarva roga kshayo bhavet. Means if you are using pranayama properly, you can cure all the diseases, or the disease symptoms can be lowered. प्राणायामेन युक्तेन सर्वरोग क्षयो भवेत अयुक्ताभ्यास योगेन means improper use of pranayama can create sarva roga samudbhavaha means all diseases can be created. So while doing pranayama, from expert we should learn the pranayama and do pranayama. Sectional breathing, simple sectional breathing, abdominal breathing, thoracic breathing, clavicular breathing, and full yogic breathing we can promote here. Breathing exercises, chest opening exercises means hands in and out breathing exercise, then hand stretch breathing exercise, and tiger breathing exercise. These are the some breathing exercise or Marjari Asan. I think Sabnis Kaka can know that Marjari Asan, or we can use here for uh, creating destroying imbalances at pranama kosha. Then PET is a special technique. PET means pranic energization technique. It is specially used in SVASA, Swami Vivekananda Yoga Anusandhan Sansthan. It is developed by Dr. Nagendra HR Nagendra, which SVASA is a world-class yoga university based at Bangalore, and they are having 250 bedded yoga therapy in-house residential Arogya Dhama, where Dr. Nagaratna, who she is a MBBS MD, and devoted her whole life for treatment of patients, psychosomatic and psychiatric illnesses, NCDs, with yoga therapy. She practices only yoga therapy, consults only yoga therapy. She has developed this PET, pranic energization technique. Here, special technique is used, and as I told, that meditation is the key component in treatment of or prevention of cancer patients. At monomai kosha level, om meditation, cyclic meditation, these are the techniques we can someday, if time permits, we can see these techniques. Devotional songs, to surrender ourselves to our deity Ishta Devata wholeheartedly, and pray for our wellness. Mind sound resonance technique, MSRT, is a technique where Omkara, Akar, Ukar, Makara, Omkara components are used, and the Mahamrutyunjay mantra. It is for building our strength of mind we use here. At Vindhyamani Kosha level, counseling awareness through education we use for here. And anyhow, the patient should reach in Anandamay Kosha, that is Buddhist sheath, that is the original state, our life. So, yogic practices are designed to go this way. While using the practices for cancer patients, safety and precautions ensured every time is ensured. Fitness status of participant is always taken into consideration. How he is fit for practicing asanas, some vakrasana, then vajrasana, ardhamasindrasana, viparit karni. All these asanas, if he is fit for that asana, he will practice that asana. Vigorous practices like Surya Namaskara, Kapalbhati, Bhasrika avoided here. Blood counts taken into consideration. Bony metastatic status must be noted, because if the metastasis is in bone, cancer spread is happened in bones, then fracture possibility is more. So we have to take care while doing asanas. Emphasis on simple, gentle hatha asanas. Simple asanas, very simple asanas we use here. More emphasis on sukshma vyayama, pranayama without kumbha, as I already mentioned. Emphasis on different types of meditations. Intensive meditation can promote regression. There is one case study that some patients who are practicing intensive meditation can uh, spontaneous regression can be possible. I think in Australia, doctor has mentioned that case in 1979. So, while thinking the in cancer prevention, what we can do, yogic way of life, in which a disciplined life without overindulgence. Tasmad asakta satatam karyam karma samacharit, as we described in Bhagavad Gita. All the time we have to do unattached. or overindulgence. We should avoid overindulgence. Yogic diet, we should promote. We should take yogic diet, sattvic diet. Regular practice of basic set of asanas means standing, sitting, prone, supine position asana. We can practice pranayama meditation for 30, 40 to 50 minutes daily, and always work as a karma yoga way. In Ayurveda, it is a very nice shloka that in nityam means all the time. Hitahar vihara sevi. Hitahar means diet and vihara means lifestyle. Samikshakari, one who analyzes it. Visheshu asaktaha means to hear, to see. We should not overindulgence on these subjects. Data, one who is giver only, always giver, helping nature. Satyapara, on the uh, path of truth. Shamavan, we should not be we should always be Kshamavan means we should forgiveness is the quality and we should virtue we should promote all the time. Aptopasevicha means we should serve our elders, our guru, or our mata pita, father, parents. We should serve them wholeheartedly so that bhavati arogaha means when we do all these things, we can be disease free. We will not have any disease. So these are the preventive guidelines with yoga and Ayurveda we can do. Now, uh, with these words, I will pray for the welfare of all. Sarve bhavantu sukhinah, sarve santu niramayah, sarve bhadrani pashyantu, ma kaschit dukkha bhag bhavet. Om Shanti, Shanti, Shanti.
Thank you very much, Dhananjay. It was all very useful information. And thank you, Balkrishna, for and Archana, all three of you, for there's a lot of information, and I think people need to digest it. If there are any questions, please ask. I know it's 9:30, but again, if it is only if it is convenient for both Dr. Balkrishna and Dr. Dhananjay, then we can have a few more questions.
We are available. Yeah.
Okay.
दादा मैं विचारू का?
Yeah, sure. Go ahead.
This is my question for Dr. Jahagirdar. You said in that slide that mammograms should be continued for healthy female after maybe 10 years after 70. So what after that, 80 plus, do you still recommend that?
Mm-hmm. Yeah. So, it has to be a decision that is made on case by case basis. What I mean by that is I have patients who are in their 80s who are extremely fit and they have longevity in their family, that their mother, father, other relatives have lived a long time, well over 100. So in those people, they still have their life expectancy is still 10 years and they don't have any other health problems. So I'm not opposed to doing it. And insurance companies will usually defer the decision to the treating physician. So yes, there are some, we are trying to get away from over treating cancer. So previously our treatments used to be very extensive for cancer. Now there's a condition called stage 0 breast cancer, which is called ductal carcinoma in situ, for which we are recommending just watching it in elderly patients and sometimes even just putting them on a medicine that blocks estrogen, tamoxifen medicine. So if we find a stage 0 cancer at that age, it may not be worth putting the woman at age 80, 82, 85 through that extra trouble of undergoing surgery. For sure, we do not do radiation at that age. Lymph node removal is also not done at that age. So if at all, just removing the lump itself is done. And so we have to always think through the whole process. We have to think about what are the implications of each of those things. Why do we not do the mammogram? If the person is unfit to undergo further treatment, what's the point in finding out about the cancer? That's not going to be a problem for the next 5 years, 10 years, if other things are going to be more life-threatening to that person. So it's an individual decision based on case-by-case basis.
Thank you
Praveen,
so much.
did you have a question? Praveen?
Yes, Kaka, I had a question. Namaskar, doctor.
Praveen,
Excellent
tell
session.
us a little bit about yourself also.
Yeah. Doctor, I just want to give you a background. I am a stage 4 cancer survivor. I was given 3 months to live. This was 4 years back. I'm still around. And I have a lifestyle, yoga and meditation, a lot of which Dr. Inchekar already covered. And in my case, my protocol actually involves a lot of the things in practically almost 90% of what he mentioned. So I can vouch for the validity of that data, being a experienced or rather somebody who's experienced this. I do have a question though. The question specifically is from the fact that Doctor, as you rightly pointed out, Vandana Tai also, Archana Tai also mentioned it when she was covering it, that there is a lot of fear when you get diagnosed, and obviously we tend to outsource our well-being to a doctor, because we've been programmed since childhood that if the car breaks down, go to the mechanic, and if the body breaks down, go to the doctor. So now when we go to the doctor, and typically while all the things that you mentioned, science advancements, the various treatments, targeted treatment, they're still in a very nascent state. I mean, I go to Memorial Sloan Catering, I see a slew of people there. Have conversations with my doctor. They do talk about integrated medicine, but it's more like a compliance tick mark for them than actually integrating it. Memorial Sloan, as you know, is one of the leading cancer research hospitals. I have experienced the same. I mean, after my story, a lot of people, thousands of cancer patients have reached out to me. A few tens of them have already got cured following a good lifestyle which they followed. Again, I do it very philanthropically without any intent of money. So the question really is, how do you empower the cancer patient, saying that, you know what, you are equally involved in this that as I am. And I have seen cases where patients are scared, saying that, Praveen, I have been told to do chemo, and I have been told with such force that if I don't do it, I have been told I will pretty much not survive. That I think that behavior is so scary, because how does that patient then really take charge of his own or her life?
Yeah,
Uh,
well, thank you for sharing. Thank you for sharing your experience, and congratulations on, beating your cancer. It is a team effort. It is a team effort. Absolutely. I think it has to come from both points. Just remember, to hammer, everything is going to look like a nail. So there's always going to be a limitation of each pathy, each science, and each training. So there are biases that are inbuilt into the training. So if you ask, for example, so when Kaka asked me to present here, I said, this is great, but I want to make this an integrated discussion, more or less. So that's when I said,
Absolutely.
my good friend Inchekars are really experts in this. Let me bring them on, because that's really important for us as physicians, to look at the patient as a whole person, as the family, as a whole family, rather than just saying that this is how I would treat it, because it's not me who's getting the treatment. I will be going home after that. So it is a shared decision making. And now it's changing, actually. The philosophy is changing in medicine as well, in modern medicine as well. That shared decision making is being made a part of it. And it all depends on how a person is brought up, actually, meaning to a certain extent. And so I think we all of us see a population that's kind of skewed in one or the other direction, right? So the people who are reaching out to you have had that experience, but at the same time, the denominator may be large, that other patients have not had that same experience, that they're not sharing with you, because who is trying to reach out to someone who has been successful in doing this is someone who has had that type of experience. So the denominator may be large, but nevertheless, I think I would not like that doctor who is forcing some decision on me or on my family. So that has to be respected. And I think that may be at a certain level a systemic fault as well, and that's being corrected.
Thank you, doctor.
Thank you. All right, again, if you have more questions, I think we can just send them to me and I will forward it to, and I'll share the contact information for Dr. Balkrishna Jahagirdar and also, yeah. Okay.
I think there are some questions in here or no?
Okay, go ahead. If you, sorry.
No, I don't see any. No, just. Okay, thank you everyone. I thought there were some questions in the chat, but I don't see any. Thank you so much. Thank you for giving us the opportunity, and thank you for attending it at this hour. And Praveenji, thank you so much for sharing your experience.
Thank you, doctor. Thank you so much. Very valuable session.
Thank you very much, Dr. Balkrishna, Dr. Dhananjay. And again, I will process the recording and share it with you. It may take a little bit time because there's another person that does it, and then depending on his availability, I'll get the YouTube recording and share it with you, along with the contact information for Dr. Jahagirdar and also Dr. Inchekars. Thank you very much.
Thank you all. Thank you.
Thank you.
Namaskar, Dhanyavad.